everyone. Learned professionals, dear friends, it is truly a great pleasure to once again open this conference organized by the Association of Child and Adolescent Mental Health Malta. I would like to start my contribution by commending you on your efforts to raise awareness in the area of maternal mental health. I would also like to congratulate you for your efforts to influence national policies. Undoubtedly, your efforts will help to improve attitudes towards maternal mental health in our country. During last year's commemoration of World Maternal Health Day, I was explicit that issues of maternal health are not simply women's issues. I believe that it is important that each member of our society realizes that issues of maternal health are intrinsically tied to fundamental human rights. I also believe that maternal mental well-being is an essential component in the healthy development of our families and communities. We need to promote maternal mental well-being to ensure healthier lives for all the citizens of the Maltese Islands. Achieving the healthy development of our families and communities is also at the heart of the United Nations Agenda 2030 and its Sustainable Development Goals, and in particular, Sustainable Development Goal number 3. SDG 3 focuses on ensuring holistic health and sustainable well-being for all the peoples of the world. Agenda 2030 provides all countries with practical guidelines for the necessary action plans for a sustainable future for all humanity. Agenda 2030 also proposes ways for each one of us as individuals and as communities to take action to improve the well-being of our societies. The mental and physical health of mothers is definitely the cornerstone of stronger families. The mental and physical health of mothers is also essential to ensure the well-being of society. In this context, issues of postpartum depression affect mother-infant relations, child growth and development, and family well-being, as Dr. Felicia was so aptly describing. I believe that there is a need for us to work together to develop parallel strategies, both at national and at European level. I also believe that now is the time for us to push for relevant directives within the European Union, since these are still lacking. We need European-level directives which further highlight the need for a holistic strategy and action plan on maternal mental health. In this way, the authorities of member states will be bound to act. Moreover, we will have an opportunity to work in synergy across Europe while sharing good practices. This is especially necessary in the context that, according to reports from MSD for Mothers, 54% of pregnant women in 9 European countries lacked access to maternal health care and were living in poverty. If such women do not even have basic maternal health care, then they are still less able to access effective care for maternal mental health. In response, we need to further strengthen the links across our nations and within our communities while taking practical actions to show solidarity with all mothers who are experiencing issues of mental health. On the other hand, Malta's systems for maternal health are effective, yet there is still much to do in the area of maternal mental health care. Unfortunately, stigma is still a blocking factor for people, including mothers, to ask for help with issues of mental health. We cannot allow stigma and silence to continue to surround vital issues of mental health. I'm sorry to say that there is research which shows that the stigma attached to mental health increases even more for mothers with depression. Unfortunately, research also shows that a sense of shame and the reluctance to seek help by mothers is prevailing. Some of the fear experienced by women is a result of the social and cultural pressures to be a perfect parent. Hence, this leads many women to remain silent. There is no doubt that motherhood is a wonderful time in a woman's life. However, we must encourage women to speak about the stress and the challenges which form an integral part of motherhood. Reaching for help when we need it should not be seen as a sign of weakness. It is often one of the most courageous things we can do. Sharing, connecting, and building honest and open relationships are crucial for mental well-being. The sense of openness should be part of day-to-day family life. We must be comfortable to ask for help from family members and friends. Often a simple conversation is the first step towards receiving support and help. We must do more as a concerned society to safeguard the mental health of all, including mothers. We need to reach out to mothers who experience challenges to their mental health. Entire families will benefit from strategies which empower women, particularly those going through or who have gone through pregnancy. We must do more to nurture stronger synergies between civil society and national authorities to ensure that the necessary and relevant policies are effectively and fully implemented. On the other hand, the experiences of women must continue to be included in the formulation and the ongoing review of our relevant policies. Women and families deserve to be supported in a variety of ways, especially when issues of mental health as a result of pregnancy become a cause of concern. According to indicators from the World Health Organization, about 10% of all pregnant women and 13% of women who have just given birth experience a mental health disorder, particularly depression. These indicators are even more alarming in developing countries, where over 15% of women during pregnancy and 19% of women after childbirth are reported to experience depression. However, the good news is that maternal mental health disorders are treatable. We must ensure that mothers experiencing depression and other conditions know that there is a light at the end of the tunnel. However, we must ensure early detection. Pregnant women should receive screening, and I'm very pleased to hear that this is starting at their very first appointment and throughout their journey through pregnancy. Early, effective interventions and interdisciplinary action is needed. Pregnant women and mothers in the postpartum period can and should be screened for maternal mental health disorders. More constructive efforts must be made, as research shows that 50% to 75% of mothers with mental health issues are not detected, although pregnancy and postpartum is the time when women have the most contact with healthcare professionals. Furthermore, let us not forget that although fathers don't experience the same physical changes as women do, through pregnancy and childbirth, they are still exposed to some of the same triggers of stress, which can lead to depression. I believe that there must be a holistic approach to treating the mental health of families. The mental health of our individual families is also reflected in the well-being of our communities, our society, and our nation. I would like to encourage all stakeholders to work together to develop support systems which are equipped with the necessary resources to make effective interventions for women to build their resilience. Healthier mothers are an investment on the well-being of our communities and the Maltese society as a whole. Let me conclude by once again emphasizing the urgent need for the introduction of screening, but we know that it's starting from the start of pregnancy to identify and prevent maternal mental health disorders. On the other hand, if diagnosed, mothers should be supported at every step of their journey towards improved mental health and well-being. We must ensure that such screening is accessible to all. We must pool our resources across civil society to lobby our national and European authorities to ensure that there are enforceable and effective directives which address issues of maternal mental health. These directives would be of particular benefit to all of our family of nations. Finally, we must do more to break the stigma associated with issues of mental health, including maternal depression. It is not acceptable that a woman should feel alone with her struggles, especially in a society like ours, where we honor and respect so much the role of motherhood in so many ways. Thank you for your attention, and I really look forward to the outcomes of your deliberations.